Delighted to say Dr. Adrian McGoldrick is with us. Dr. McGoldrick, good morning to you. Normally we're talking about horse racing on Friday Night Racing with you, but it's been an interesting week in terms of your own public utterances. You shared an article from the New York Times which talked about the potential complications for people who've had COVID and heart difficulties that they might suffer, and particularly this is something that has essentially had a massive impact on college football in America and on American society, and then subsequently revealed that you had some post-COVID complications yourself.
Yes, Ger. I had myself swabbed for COVID last May, as I had 3 patients in a nursing home positive with COVID. I was basically asymptomatic, some very mild symptoms, but at the time I would have put them down to actually fatigue from working in the garden, because that was the time of the very good weather. But I isolated for 14 days, went back to work. I did have a spinal operation in the interim. I popped a disc and have a spinal fixation, but I came home after 4 days, went back in and working remotely in the practice for 5 weeks and felt absolutely fine, but eventually returned to practice 6 weeks ago, lasted 4.5 days and literally could not get out of bed with profound fatigue. Spent 3 days in bed, went back to work the following week, again lasted 4.5 days, and again just this most profound fatigue, which is literally indescribable. Literally hadn't the energy to lift my hand to pick up a phone. So my partner, Bernard Healy, rightly so, we both agreed that I should take some time out. I was still trying to cover some race meetings I was committed to, but I found even after a race meeting, which is not very physically stressful, I just hasn't been of late, thankfully. Not too many followers, so I'd be mainly just sitting in the ambulance, walking as little as possible. But even after that, I'd end up in bed for a day or two. So having assisted again with Jennifer Pugh, Jennifer Sicknover as Senior Medical Officer, and with Bernard, I decided I definitely should go for further investigations. So I was admitted to the Beacon last Tuesday week, and all my bloods have been repeatedly normal in the surgery, repeatedly normal in the hospital, although there are some outstanding more detailed tests. But the one thing that did turn up was that on the cardiac MRI I had myocarditis. Now, the only common denominator was the positive COVID test 3 months previously, and fit in with the time scale of other post-COVID myocarditis. Potentially there may be some other causes which we haven't found, but as I say, the only common denominator was the COVID. And certainly reading other articles I've read on post-COVID myocarditis, and my cardiologist felt it was the most likely option as well, Dr. Robert Kelly at the Beacon. So the reason I decided to treat was more to put a warning out to people who would, because I think we're beginning to get a little bit lackadaisical about COVID. We were very good at the beginning in our observations of our social distancing, our wearing of masks, our hand washing. I think some of the younger people are of the notion that COVID is only a disease of older people, or at least complications are only a problem for older people. I was trying to get the message out. This disease should be avoided at all costs, because there's nobody is safe from it. As you mentioned, that article in the New York Times last Monday week mentioned about college football in America being decimated by it. It also gave the human cost of it in the effects it's having on young people very, very vividly. Not everybody possibly would have had a chance to read that article. But then in relation to that study from Germany, which looked at a cohort of 100 people who either were asymptomatic or mildly symptomatic, but had made a full recovery with a mean age of 45, and 3 months later, 79% had heart problems, literally 60% with myocarditis. And so really that was my message. Look, be very, very aware of this disease. This is lethal. This is something, I'm 40 years in general practice. I've never seen anything next or near like it. It's a highly dangerous, a highly lethal virus. We must keep up our vigilance. I think the Irish people as a whole, as I said before, with very good public health advice and government following that advice, we've done a super job, but we must just keep this vigilance up for the foreseeable future.
You made the point as well, subsequent to tweeting out the article and then tweeting out your own story, seeing the response to my tweet about myocarditis post-COVID, I would plead with the National Treatment Purchase Fund to provide cardiac MRI to all public patients with any COVID symptoms. Is
Yes,
this...
because
Go on, sorry.
the reason I say that is that I'm one of the lucky people to have private insurance. I did an echocardiograph, which was an echocardiograph which is normal, would normally be diagnostic of heart disease. The only test with me which showed up that I had myocarditis was a cardiac MRI. Now, there's a limited availability of those in hospitals in Ireland, mainly in the private hospitals. To my knowledge, it's not available in the National Purchase Treatment Fund as of now. But my fear is that people who may not have private insurance will have similar symptoms to me, will possibly have a normal echo like me and put down as being probably just chronic fatigue syndrome, or as I said, in lesser cases as possibly being psychological, which certainly it is not. And I would not like anybody to have a ongoing chronic fatigue due to myocarditis and not have an appropriate diagnosis. And I know my colleagues who are cardiologists would certainly like to be able to make that definitive diagnosis as well and provide the appropriate advice.
So would this be when they get COVID first, or is it tends to be 3 months later is the sweet spot where you use that?
Yeah, there are obviously in the more severe cases of COVID, it can occur earlier on, but certainly the data coming out now is that it can be one of the delayed side effects. I mean, COVID is a multifactorial disease. I mean, there's no organ in the body spared. It can affect your brain. It can naturally, we all notice that it's a disease of the lungs, but now the long-term data, if you call long-term 6 months, it's showing that perhaps there's actually there are more problems with the heart than anything else. It naturally causes clots in the legs, causes microclots in the skin, affects the adrenals. Affects the skin. So there's literally no organ saved. So it's a very unique virus. As I said, I've been 40 years in practice. I've never seen anything like it. So I think it's just we need to get that warning out to people. This is a really serious virus. Don't ease up on what you're doing. I agree that there's naturally a financial cost to the state and to businesses, but there's a morbidity as well, and we do not want a large cohort of our population with long-term problems into the future, both for them personally and for the state as a provider of medical care. So it's trying to get that balance between good health, good public health, and keeping the state finances rolling over. It's a difficult balance to do, but I think as a country, we've done a pretty good job. We are still on our first wave. We're bouncing on the bottom of it. Many countries in Europe are back in their second waves. Hong Kong's in its third wave. So I think as a people, we've done an amazing job. And my just reason was to just try and encourage people, please continue to observe all the norms we've been asked to do.
I've one last question before you just bring in Shane on this. We don't really know about the long-term impact of the kids who get this just yet. So a lot of parents are concerned about sending their kids back into the school environment. Earlier in this, they were super spreaders, and then it was like, actually, it has no impact on them, so it'll be grand. But, you know, if we're only beginning to get to grips with the fact that 3 months later, adults are suffering fairly significant heart issues, this might be an issue for kids as well.
Again, it's too early. I mean, the initial data would show that certainly under 10, they're highly unlikely to have any symptoms. Although, I mean, we know that earlier this week we had 4 children in Crumlin with it. But under 10, there doesn't appear to be a significant, there's a morbidity, very small morbidity with it. Over 10, there's a higher risk. There definitely are carriers, but they do seem to be more resilient, certainly. So I think, again, this is part of this balance we're trying to achieve. I personally would support the return of children to school. I've got 2 grandchildren here in Ireland who are going back to school the week after next. I would fully support that with the appropriate public health guidelines. So I think it's all part of this balance of health and what's good for the people and for the state. So I would personally support the reopening of schools with the appropriate criteria in place.
Adrian, for people who may not have heard of myocarditis, and I know, I've seen on Twitter you're talking about how you would have worked 16-hour days, and there are days now where you can barely get out of bed. But How would you describe the condition of myocarditis for people who maybe haven't heard of it, and especially for the benefit of people who are maybe not wearing masks or still going out to parties or house parties? What's the condition like on a bad day for you?
Well, what myocarditis is actually an inflammation of the heart muscle. So the heart muscle is not basically up to the job. I mean, as I said, I would work 16, 18-hour days and literally wouldn't take a feather out of me. When I was at my worst a month ago, I physically could not get out of the bed. I would literally prefer to have curled up and died. I felt so miserable. I mean, I could not believe how fatigued I could be. I literally could not lift myself up in the pillow. I just would not wish it on anybody. The fatigue is just so profound. As I said, I'm up early this morning for this reason. Up until today, I would not be getting out of bed at 12 o'clock because I've been advised to try and get 8 to 10 hours to 12 hours sleep where possible, or at least rest. And the only treatment for this is resting the heart in the hope that the muscle will settle itself. So there's no medical management for it, and that is the problem. And the other risk, again, is if you don't follow that advice and do overexert yourself, there is a possibility of getting an arrhythmia or an irregular heart rate, which could cause your heart to stop. So this is not something to be sniffed at. It's something you do need to follow very good medical advice and do what you're told.
Adrian, one of the things that really struck me from that New York Times piece that we referenced that you tweeted out was one of the stats that since February, nearly 25,000 more Americans have died of heart disease compared with the same period last year. And I know the American Heart Association have their Don't Die of Doubt campaign. Surely some of those deaths are down to this myocarditis, but others are down to the fact that people aren't going to the hospital anymore because they don't feel safe doing so. So what would you say to those people who maybe are putting off their hospital appointments?
No. It was across all causes of heart disease. And we definitely, I know in my own practice from speaking with Bernard, who's my partner, speaking with other colleagues, people are putting off going for checkups, be it for heart disease, obviously, which is potentially lethal, for diabetes, for all the other diseases. We know that the diagnosis of cancer has fallen by over 50% during this COVID, and that's simply because people are putting it off. I would plead with people, with anybody out there who's feeling unwell. General practice are actually very safe places to go because we're working under very strict hygiene criteria. They're absolutely safe places to go, and I would plead with people, do contact your GP if you have symptoms, and please follow up on your chronic disease, be it heart disease, diabetes, etc.
Adrian, I'm sure you would have had a couple of months there, possibly with maybe very few or little to none positive diagnoses for COVID-19. And I'd seen you mention that you'd had a few even in the last week or two. So are you concerned people aren't taking public health advice seriously enough? I know you're based in Newbridge as well, so Kildare still on lockdown. Yeah. So what's the general vibe down there? Are people taking it seriously?
The vast majority are. I haven't been out very much, quite honestly, but I know chatting with Anne, my wife, while out shopping, again, there's still a minority who are not wearing masks. We're still seeing people not social distancing. Yeah, we have definitely had a spike in Kildare. Vast majority, as you know, within meat processing plants. But I've had 3 patients in my own practice positive last weekend. No obvious source for it. So we are seeing a spike. Again, a lot of cases, unfortunately, 9 out of 10 people are asymptomatic or have very mild symptoms, and sometimes we cannot pick up where it's coming from. But all I can say is to those who are not following the guidelines of wearing their masks, washing their hands, avoiding social distancing, and particularly the young people who are going to parties, think twice, because it's not just about your family, your relatives, it's about you, because we do know this has a morbidity for young people. And I think young people need to look in the mirror and think about themselves for a start, not just about this is a disease which does not affect me.
Yeah, absolutely. I think that's a very powerful way to wrap this up. Dr. McGoldrick, it's always great to talk to you. Thanks a million for making the time for us, and we wish you the very best in your recovery.
Thank you very much, Andy. Thank you very much. Take care. Bye-bye.
It's Dr. Adrian McGoldrick there, who obviously made his reputation in the public sphere as a doctor with the Turf Club over 30, 40 years, but obviously now involved in general practice and coming forward to tell us exactly some of the stuff that we might need to hear, and all of us, all generations, that this is the type of thing that you really, really do not want to get. 087 9 180 180 is the number here if you want to get in touch with